Hey everyone, welcome back to the channel. Today, we're diving deep into a topic that affects millions of people around the world: sleep disorders. We all know how crucial a good night's sleep is for our physical and mental well-being, but for some, getting those restful Z's can be a real struggle. We'll be exploring the various types of sleep disorders, from insomnia to sleep apnea, to those that sound a little more unusual, like restless leg syndrome. We'll break down the symptoms, understand what causes these disorders, and most importantly, discuss the treatment options available. Remember, if you think you might be struggling with a sleep disorder, don't hesitate to reach out to a healthcare professional. Getting the right diagnosis and treatment can make a world of difference in your quality of life. So let's get started. Let's start with one of the most common sleep disorders: insomnia. If you've ever found yourself tossing and turning, staring at the ceiling for hours, you know how frustrating insomnia can be. Insomnia isn't just about having trouble falling asleep. It can also manifest as difficulty staying asleep throughout the night, or waking up way too early and not being able to fall back asleep. And it's not just about feeling tired the next day. Insomnia can have a ripple effect on your entire life, impacting your mood, concentration, and even your physical health. So, what causes insomnia? Well, it can be a complex interplay of factors. Stress is a major culprit, as are lifestyle factors like irregular sleep schedules, late-night meals, and excessive caffeine or alcohol consumption. The good news is that insomnia is often treatable. Cognitive behavioral therapy for insomnia, or CBTI, has proven to be highly effective in addressing the negative thoughts and behaviors that contribute to insomnia. Good sleep hygiene practices are also essential. This includes creating a relaxing bedtime routine, making sure your bedroom is dark, quiet, and cool, and avoiding screens before bed. Remember, a good night's sleep is within reach with the right approach. Now let's talk about a sleep disorder you might not even know you have: sleep apnea. It's more common than you might think, and it's often underdiagnosed. Sleep apnea is characterized by repeated pauses in breathing during sleep. These pauses, called apneas, can last for several seconds and happen multiple times throughout the night. The most common type is obstructive sleep apnea, where the airway becomes blocked, usually by the soft tissues in the back of the throat. Another type is central sleep apnea, which is less common and occurs when the brain fails to send proper signals to the muscles that control breathing. One of the telltale signs of sleep apnea is loud, chronic snoring. Other symptoms include waking up gasping for air, excessive daytime sleepiness, morning headaches, and difficulty concentrating. Untreated sleep apnea can increase the risk of serious health problems like heart disease, stroke, and diabetes. Thankfully, effective treatments are available. Continuous positive airway pressure, or CPAP therapy, is the gold standard. It involves wearing a mask over your nose or nose and mouth while you sleep. The mask is connected to a machine that delivers a constant stream of air pressure to keep your airway open. Other treatment options include oral appliances that help reposition the jaw and tongue, and in some cases, surgery may be recommended. If you suspect you might have sleep apnea, it's crucial to consult a healthcare professional for proper diagnosis and management. Imagine this. You're trying to relax, maybe watch a movie or read a book, but you have this uncomfortable sensation in your legs, an irresistible urge to move them. That's restless leg syndrome, or RLS for short. It's a neurological disorder that causes uncomfortable sensations in the legs, often described as creeping, crawling, tingling, or aching. These sensations are usually worse at night or when you're resting, making it difficult to fall asleep and stay asleep. The exact cause of RLS is still unknown, but it's believed to be related to an imbalance of dopamine, a neurotransmitter that helps regulate muscle movement. Genetics also play a role, as RLS tends to run in families. Certain medical conditions, such as iron deficiency, pregnancy, and peripheral neuropathy, can also contribute to RLS. While there's no cure for RLS, there are effective ways to manage the symptoms and improve sleep quality. Medications that increase dopamine levels in the brain are often prescribed. Lifestyle modifications can also make a difference, such as regular exercise, avoiding caffeine and alcohol, and maintaining a regular sleep schedule. In some cases, compression stockings or pneumatic compression devices may also provide relief. If you're experiencing symptoms of RLS, don't hesitate to talk to your doctor to get a proper diagnosis and discuss treatment options. Narcolepsy is a chronic neurological disorder that disrupts the brain's ability to control sleep-wake cycles. People with narcolepsy experience excessive daytime sleepiness and can fall asleep suddenly, even during activities like driving or working. Imagine feeling like you haven't slept in days, even if you've had a full night's rest. That's the reality for many individuals with narcolepsy. This overwhelming sleepiness can make it challenging to concentrate, hold a job, or even maintain relationships. One of the hallmarks of narcolepsy is cataplexy, a sudden loss of muscle control triggered by strong emotions like laughter, excitement, or anger. Imagine laughing at a joke and suddenly collapsing to the floor, unable to move. That's the reality for many people with narcolepsy who experience cataplexy. Another common symptom is sleep paralysis, a temporary inability to move or speak while falling asleep or waking up. Imagine waking up from a dream and realizing you can't move a muscle or call for help. It can be a terrifying experience. The exact cause of narcolepsy is still being investigated, but it's believed to be an autoimmune disorder where the body's immune system mistakenly attacks the cells in the brain that produce hypocretin, a neurotransmitter that regulates wakefulness. While there's no cure for narcolepsy, there are effective treatments that can help manage the symptoms and improve quality of life. Stimulant medications can help improve alertness and reduce daytime sleepiness. Medications can also be prescribed to manage cataplexy and other associated symptoms. Lifestyle modifications, such as taking scheduled naps throughout the day, maintaining a regular sleep schedule, and getting regular exercise, can also be beneficial. Our bodies have an internal clock, known as the circadian rhythm, that regulates our sleep-wake cycle, hormone release, and other bodily functions. But sometimes this internal clock can become misaligned with the external environment, leading to circadian rhythm disorders. Imagine feeling wide awake when you should be sleeping and exhausted during the day. That's the reality for people with circadian rhythm disorders. These disorders can disrupt sleep patterns, leading to insomnia, excessive daytime sleepiness, and difficulty concentrating. One common type is delayed sleep phase disorder, often referred to as night owl syndrome. People with this disorder have a natural tendency to go to bed and wake up later than what's considered normal. Another common type is shift work disorder, which affects people who work night shifts or rotating shifts. Their sleep-wake cycle is constantly disrupted, leading to sleep problems and other health issues. Jet lag is a temporary circadian rhythm disorder that occurs when you travel across multiple time zones. The good news is that circadian rhythm disorders are often treatable. Light therapy, also known as phototherapy, can be highly effective in resetting the internal clock. It involves exposing yourself to a specific type of light at certain times of the day to shift your sleep-wake cycle. Other treatment approaches include behavioral therapies, such as maintaining a regular sleep schedule, creating a relaxing bedtime routine, and avoiding caffeine and alcohol before bed. Medications may also be prescribed in some cases to help regulate sleep patterns. If you suspect you might have a circadian rhythm disorder, talk to your doctor to get a proper diagnosis and discuss treatment options. Now, let's delve into the realm of parasomnias, a group of sleep disorders characterized by unusual behaviors or experiences during sleep. These behaviors can range from sleepwalking and sleep talking to more unsettling experiences like night terrors and REM sleep behavior disorder. Imagine waking up to find yourself in a different room, having cooked a meal or even driven a car, all while you were sound asleep. That's the reality for some people with sleepwalking disorder. Sleep talking, also known as somniloquy, is another common parasomnia. It involves talking aloud during sleep, and the content of the speech can range from mumbling to full-blown conversations. Night terrors, on the other hand, are much more intense. They typically occur during non-REM sleep and involve episodes of screaming, fear, and flailing limbs. REM sleep behavior disorder is a parasomnia where people act out their dreams, often with violent movements or vocalizations. Imagine punching, kicking, or even jumping out of bed while dreaming about a fight. The exact causes of parasomnias are not fully understood, but they're believed to be triggered by a variety of factors, including genetics, stress, sleep deprivation, and certain medications. While most parasomnias are not considered dangerous, they can be disruptive to both the individual experiencing them and their bed partner. Treatment for parasomnias often involves addressing any underlying medical or psychological conditions that may be contributing to the disorder. Medications may be prescribed in some cases, and lifestyle modifications, such as improving sleep hygiene, managing stress, and creating a safe sleep environment, can also be helpful. Thank you for joining us on this journey to understand sleep disorders. Remember, getting a good night's sleep is crucial for our physical and mental well-being. If you suspect you have a sleep disorder, don't hesitate to consult a healthcare professional for proper diagnosis and treatment. There are effective treatments available for most sleep disorders, and getting the help you need can significantly improve your quality of life. We've covered a lot of ground today, from insomnia to sleep apnea to the more unusual world of parasomnias. But remember, knowledge is power. The more you understand about sleep disorders, the better equipped you'll be to advocate for yourself or your loved ones. Don't forget to like, share, and subscribe for more informative content.